Thank you so much for making the time to join me today. I want to start by acknowledging that the work that health coaches and health providers do for women going through perimenopause and menopause is irreplaceable. You are often the first person a woman tells that something is wrong. You are the one who sits with her, listens to her, and helps her make sense of a body that seems to have changed overnight. This matters enormously. My name is Florence Iwegbue. I'm the co-founder of Livewello. I'm also a 51-year-old perimenopausal woman. I do yoga, kickboxing, Pilates, and high daily step counts. I also have spent years trying to understand why my body was responding to perimenopause the way it was, differently from women around me, even the ones with similar lifestyles. Livewello gave me the answer, and today I want to show you how it can give that answer to you and every woman in your practice. The title of this conversation is Where Movement Meets the Molecule, because the best coaching and clinical work in the world becomes even more powerful when a woman understands the genetic reasons why her body responds the way it does. When menopause begins disrupting a woman's life, her sleep, her mood, her energy, her body composition, her confidence, she doesn't start by Googling a specialist. She calls her health provider. She messages her naturopath. She books an appointment with her GP or her integrative practitioner, or she calls her health coach. She turns to the person she already trusts, and that is you. And that question she's bringing to you is almost always a version of, why is this happening to me specifically? Not, what is menopause? She already knows what it is. She wants to know why her experience is the way it is. Whether you are a nutritionist, a wellness coach, a fitness professional, a physiotherapist, GP, or naturopath, your value is the personalized guidance that you give. Livewello is built to make that guidance more precise than it ever has been before. Because here is the thing, women navigating menopause are increasingly sophisticated. They have done the research. They are taking supplements, tracking their sleep, working with multiple practitioners. What they are missing is the genomic layer, the biological explanation for why their experience is uniquely theirs. And that is exactly what Livewello provides. You know what perimenopausal women should do. You know the clinical evidence, you know what helps, the lifestyle adjustments, the nutritional interventions, the movement modifications. You're brilliant at it. But your clients are still asking questions that generic knowledge cannot fully answer. Why are my hot flashes so much worse than my friends? We eat the same diet, we are the same age, and we have a similar lifestyle. Well, the answer is in their ESR1 and COMT gene variants. These determine how sensitively a woman responds to estrogen and how quickly her body clears it. Two women with identical lifestyles can have completely different hot flash severity because of a single genetic difference. Livewello surfaces this in plain language. Why does my brain fog hit me so hard, but my sister barely notices any cognitive change? Well, the BDNF VAL 666 MET and MAOA variants affect neurotropic support and dopamine regulation, both of which decline when estrogen drops. Genetic variations means this decline hits some women cognition far harder than it hits others. I do everything right. I exercise. I eat well. I track my sleep. Why can I still not sleep through the night? Well, the COLCK and ASMT genes shape the melatonin production pathway. The right intervention for persistent sleep disruption depends entirely on which part of that pathway is affected, and that is different for every woman. Why is high intensity exercise making me feel worse and not better? Well, the HSD11B1 and adrenal genetics affect cortisol metabolism. For some women, high intensity exercise during perimenopause is a genuine physiological stressor, not a motivation problem, not a lack of fitness, a genetic reality that demands a different approach. These are not unanswerable questions. These answers are written in each woman's DNA. Livewello reads them and gives every practitioner in the room the precision layer they have been missing. Let me walk you through how Livewello works. From a user's perspective, it is remarkably straightforward. Step 1. A woman gets started with her DNA test. She can use the Livewello DNA Kit, which is a simple at-home saliva swab, lab processed and linked directly to the platform. Or if she has already done an Ancestry DNA or 23andMe test, she can connect that raw data to the file instead. Either way, getting started takes minutes. Step 2. Livewello analyzes hundreds of gene variants that are specifically linked to menopause, hormone metabolism, mood, sleep quality, and exercise response, not general health, menopause specific. Step 3, and this is where it becomes genuinely different from anything else available. She receives a personalized insight in plain, accessible language, not estrogen declines with menopause. That is not useful. Instead, we tell you your ESR1 gene variant means that your tissues are particularly sensitive to estrogen fluctuations. This is why your hot flashes are more frequent and more intense than average. And here is what the evidence says helps for your specific pathway. That is actionable, that is personal, and that is hers. Step 4, she receives tailored guidance on foods, supplements, and exercise based on her own genetic profile, not population level recommendations dressed up as personal advice. Actual personalization. Step 5, she can track health records over time, monitor how her symptoms shift, and share relevant information with you, her health coach or practitioner. So every appointment starts from a richer baseline. And critically, privacy is absolute. No employer, no coach, no third party ever accesses individual genetic data without her explicit consent. This is her data in her control always. Now, let me show you what it looks like for the kind of woman already sitting in your waiting room. Now, let's talk about what this process looks like for the women in your waiting room or your client list. These 3 case studies are from Livewello's scenario library, clinically grounded, developed with practitioners to reflect patterns they see every day. I think you will recognize your clients in them. Diane is 62, a retired school principal. She stopped hiking, something she had loved for decades, because of joint pain that came on in the years following menopause. She had avoided HRT for 5 years because she could not get a clear answer about her breast cancer risk. Her mood had become flat in a way that felt different from ordinary sadness. When Livewello analyzed her DNA, her ESR1, COL1A1, and BDNF variants showed clearly that estrogen loss was hitting her joints, her bone turnover, and her neurological resilience harder than it would for an average woman. That is not a character failing. That is a genetic variability and vulnerability. Once she understood it, she could make genuinely informed choices about movement modification, targeted supplementation, and whether to have a very different conversation with her GP about HRT. Liz, is 52, a vice principal, and she was managing menopause without HRT after her mother had a clot on oral hormones. She felt she was doing everything correctly, eating well, exercising, managing stress, but generic lifestyle advice was not delivering the relief she expected. Her ESR1, CYP1B1, and VDR genes explained why targeted phytoestrogens and vitamin D mattered significantly more for her specific hormone metabolism pathway than the standard recommendations she had been following. And then there is Ruth, a family doctor, someone who should, by training, have all the answers. Her perimenopause symptoms persisted despite HRT, and when she raised this with colleagues, she felt dismissed. Her CYP1B1, COMT, and SHBG genes explained something her blood tests could not. Why her total estradiol could look perfectly adequate on paper while active estrogen exposure at the tissue level was still falling short. The test was right, the interpretation was incomplete. Three different women, three completely different genetic profiles, three completely different explanations, and three completely different pathways to feeling better. Livewello gives each of them their own. Here, I want to address something that sometimes comes up as a barrier and then show you why it is actually an opportunity. Livewello has its own DNA kit, a simple at-home saliva swab, no blood draw, no clinic visit, no third-party account to set up. You or your client orders it, completes it at home, sends it to our lab, and their results are linked directly to their Livewello profile. Everything in one place from one trusted source. This means that you do not need to tell a pet client to go to buy a 23andMe test before their appointment. You do not need to explain how to download a raw data file from a third-party platform. The Livewello kit is the complete self-contained starting point, and if a client already has a 23andMe or Ancestry DNA data, it is fully compatible. We work with both. Now, here is the commercial dimension I think that is genuinely exciting for practices. As a registered Livewello partner, you receive exclusive discounted pricing on the kit. You can order in bulk for your practice. You have a simple online portal to manage orders and access educational resources for your clients. And critically, you are free to set your own retail price to clients. You can add the Livewello DNA kit as a line item in your consultation packages, your new client welcome packs, or as a standalone premium pricing. The difference between your practitioner price and your retailer price is yours. It becomes a direct recurring revenue stream that grows with your client base, and it pairs naturally with your initial consultation or your new patient intake process. Think about what that looks like in your practice. A new client books an initial consultation, and as part of their onboarding, they order a Livewello DNA kit. By the time they arrive for their first appointment, the genomic profile is ready. The consultation is immediately richer, more personalized, more actionable, and you have already generated additional revenue before the session begins. Whether a client has existing DNA data or starts afresh with a kit, you have a seamless, profitable pathway either way. So, let me be clear about how I see this working because I think it is very important. You own the clinical and coaching relationship. That is irreplaceable. You bring the years of training, the clinical judgment, the human connection, the accountability. You know your client. You know her history, her fears, her goals, her patterns. That is your layer. and it is the most valuable layer there is. Livewello adds what we call the personal genomic intelligence layer. We explain why this particular woman's body is behaving the way it is. We give her, and by extension you, a biological map of her individual menopause experience. Personalized guidance on nutrition, supplements, and exercise that is informed by her specific DNA, not by population averages. The relationship is completely additive. Livewello does not replace your knowledge, it amplifies it. A client who understands her genetic landscape arrives at your appointment more informed, more motivated, more specific about her experience, and more open to your recommendations. For instance, my practitioner suggested I might respond better to phytoestrogens than to a standard supplement protocol, and Livewello showed me exactly why in my own genetics. That is a client who trusts you completely. That is a client who stays. You bring the expertise. Livewello brings the genomic precision. Every woman deserves both in the same appointment. There are several examples of ways you can partner with Livewello. The first option is integrating genomic insight directly into your consultation process. Clients upload their DNA data before an appointment. You arrive at the session with their genetic context already in front of you. You know before they walk in the door that this particular woman has ESR1 sensitivity, and that is likely driving her hot flash severity. Your consultation starts at a completely different depth, richer conversations from minute one. The second option is offering Livewello access as a client welcome gift or a premium add-on to existing packages, a tangible, science-backed benefit that sets your practice apart, something no other practitioner in your area is likely offering. It deepens client loyalty and signals that you are at the frontier of personalized women's health. The third option is referral partner program. You receive a personal referral link. When a client signs up via your link, you earn a recurring benefit and they receive a personalized genomic welcome. Over time, as your reputation for genomic informed practice grows, this becomes a passive income stream that compounds with every new client you bring. And the fourth option is co-creating educational content together. Social posts, newsletters, mini guides explaining how genomics personalizes menopause care, all co-branded. Positions you as a practitioner at the cutting edge of women's health. In a crowded market, that differentiation is genuinely valuable. None of these is fixed. This is a starting point. Think about what resonates for you. Let me share a few numbers that I think puts this moment in context. The productivity cost of menopause in the workplace has been quantified as $26.6 billion annually. That figure represents women leaving roles, reducing their hours, losing confidence, and being misunderstood at exactly the point in their careers when they have the most to offer. A significant part of the cost is driven by women who do not understand why their experience is the way it is, and therefore cannot advocate for themselves, access the right support, or manage their symptoms effectively. Your practice sits directly in the path of this problem. The genomics landscape has also shifted dramatically. 23andMe and Ancestry DNA together have over 30 million users. A meaningful proportion of the women who walk through your door have already done a DNA test. The data exists, sitting unused, because nobody has told them what to do with it. And for clients who have not yet tested, the Livewello DNA Kit means there is no longer a barrier. No separate purchase from a third-party company. No complex data to download. Just one simple at-home kit that connects directly to Livewello. The pathway to genomic wellness has never been more straightforward. And the third reason this moment matters is a shift in expectation. Women are done with one-size-fits-all menopause advice. They are informed, they are vocal, and they expect practitioners who can explain what is specifically true for them. Personalization is no longer a premium offering. It is becoming the baseline expectation. Genomics is the most credible personalization tool available, and Livewello is the platform that makes it accessible, private, and genuinely actionable. The practices that embrace this now will be the ones their clients refer to others in 2 years' time. I want to take a moment to step back and tell you something personal. I am 51 years old. I am in perimenopause. I do yoga, kickboxing, Pilates, and I walk a high daily step count. I eat an ancestral diet and I take a personalized supplement stack that addresses every element of my needs and is shaped by my own genetic data, my MTRR variant, my APOE, and my COMT gene variation. Livewello is not something I work on, it is something I live. When I could not explain why my perimenopause felt so much harder than the experiences of women around me, women doing all the same things I was doing, Livewello gave me the answer. It was not a personal failing. It was not that I was not trying hard enough. It was a genetic reality that I could understand, respond to, and work with. My husband Kwame is a physician. He co-founded Livewello because our family's health outcomes changed fundamentally when genomic data began guiding our decisions. We built this platform because nothing like it existed, and because we believed that the women sitting in the practitioners' waiting rooms deserved access to the same precision that guides our own health decisions. This is what we want to offer every woman your practice works with. You bring the clinical expertise, and Livewello brings the genomic precision. Every woman you treat deserves both. What you do for women going through menopause matters more than most people appreciate. You hold space for some of the most confusing, destabilizing, and undervalued experiences in a woman's adult life. We will be proud to stand alongside that to give you a new layer of precision that makes your already excellent work even more powerful. My name is Florence Iwegbue. I am the co-founder of Livewello. You can reach me at support@livewello.com or explore the platform and our case study library at livewello.com/scenarios. I am also, as I said, a living example of what this platform can do. So ask me anything, challenge anything, tell me what does not fit. That is exactly the conversation I want to have. Thank you for your time, for your work, and for what you do for women every day.